In this video, we will delve into the top 6 nutrients that can help reduce knee pain, a common issue affecting millions of adults globally. Knee osteoarthritis is prevalent, leading to significant discomfort and limiting mobility for many individuals. Understanding the health of cartilage is crucial as it plays a vital role in joint function and pain management. By maintaining cartilage health, we can potentially alleviate some of the discomfort associated with knee issues. Throughout this video, viewers can expect to learn about specific nutrients that have been shown to support joint health and reduce knee pain. Join us as we explore these essential nutrients and their benefits for improving your overall knee health and enhancing your quality of life. Knee osteoarthritis, or OA, is a degenerative joint disease characterized by the breakdown of cartilage in the knee joint, leading to various symptoms such as pain, swelling, and stiffness. As the cartilage deteriorates, it can no longer cushion the bones effectively, resulting in increased friction and discomfort during movement. This condition often manifests as a gradual onset of pain, particularly after activity or prolonged periods of inactivity. Several factors contribute to cartilage damage, including aging, which naturally decreases cartilage resilience, and lifestyle choices such as obesity, lack of exercise, and previous injuries. Understanding these aspects of knee osteoarthritis is crucial for managing symptoms and maintaining joint health, as they highlight the importance of protecting cartilage to prevent further deterioration and improve overall quality of life. Cartilage is a flexible, connective tissue that serves as a protective cushion in the knee joint, allowing for smooth movement and absorbing shock during activities. Its primary role is to reduce friction between the bones, ensuring that they glide effortlessly against each other. However, one of the significant challenges with cartilage is its limited blood supply, which hampers its ability to repair and regenerate effectively after injury or wear. This lack of nourishment makes it difficult for the body to heal damaged cartilage, leading to increased pain and discomfort over time. Therefore, maintaining cartilage health is crucial for preventing joint pain and preserving mobility. By focusing on cartilage care, individuals can enhance their overall joint function and reduce the risk of developing conditions like osteoarthritis. In osteoarthritis, or OA, 3 main factors contribute to joint discomfort. First, the decline in collagen, a crucial protein that provides strength and structure to cartilage, leads to weakened cartilage that is more susceptible to damage. As collagen levels decrease, the integrity of the cartilage diminishes, resulting in increased pain and reduced mobility. Second, overactive enzymes in the joint can accelerate cartilage breakdown, further exacerbating the deterioration of joint health. These enzymes, often triggered by inflammation, can lead to a cycle of damage that worsens symptoms. Lastly, the drying out of synovial fluid, which serves as a lubricant for the joints, negatively impacts joint lubrication. This reduction in fluid can cause increased friction during movement, leading to further discomfort and stiffness in the affected joints. In this segment, we will introduce 6 key nutrients that play a vital role in supporting cartilage health and reducing joint discomfort. Among the most commonly discussed supplements are glucosamine and chondroitin, which are often recommended for individuals suffering from osteoarthritis. These compounds are believed to help maintain cartilage structure and function, although research results regarding their effectiveness in treating OA have been mixed, with some studies showing benefits while others remain inconclusive. Despite the varying evidence, the potential of these supplements has paved the way for further exploration into other nutrients that can alleviate symptoms. In the following sections, we will delve into 6 specific nutrients that can contribute to improved joint health and comfort, providing valuable insights for those seeking relief from knee pain. UC2, or undenatured type 2 collagen, is derived from chicken breast bone and is known for its unique mechanism in promoting joint health. Unlike other collagen supplements, UC2 works by modulating the immune response, helping to reduce inflammation and support cartilage repair. Research findings have shown that UC2 can effectively reduce joint discomfort and improve mobility in individuals with osteoarthritis. In clinical studies, participants reported significant improvements in pain levels and overall joint function after supplementing with UC2. Given its promising results, viewers are encouraged to consider UC2 as a viable supplement option for managing osteoarthritis symptoms. By incorporating UC2 into their regimen, individuals may experience enhanced joint health and a better quality of life, making it a valuable addition to their approach to joint care. Boswellia serrata, also known as Indian frankincense, has a long history of use in Ayurvedic medicine for treating inflammation and promoting joint health. Traditionally, it has been utilized to alleviate pain and swelling associated with various inflammatory conditions. The active compounds in Boswellia, particularly boswellic acids, have been shown to inhibit matrix metalloproteinase, or MMP enzymes, which play a role in the breakdown of collagen in cartilage. By inhibiting these enzymes, Boswellia helps maintain collagen levels, supporting joint integrity and reducing discomfort. For effective use in osteoarthritis treatment, a typical dosage of Boswellia serrata ranges from 300 to 500 milligrams, taken 2 to 3 times daily. Incorporating this natural anti-inflammatory supplement may provide significant relief for those suffering from joint pain and inflammation. Hyaluronic acid plays a crucial role in joint health by acting as a lubricant and shock absorber within the joints. Its unique ability to retain moisture helps maintain the viscosity of synovial fluid, ensuring smooth movement and reducing friction between the bones. Food sources rich in hyaluronic acid include bone broth and organ meats, which can support the body's natural production of this vital compound. However, for those seeking additional benefits, supplementation with patented forms of hyaluronic acid can be particularly effective. These specialized formulations are designed for enhanced absorption and bioavailability, providing targeted support for joint health. By incorporating hyaluronic acid through diet or supplements, individuals may experience improved joint function, reduced pain, and enhanced overall mobility, making it an essential component of joint care. Vitamin C plays a vital role in collagen production, which is essential for maintaining healthy cartilage and overall joint health. As a powerful antioxidant, it helps protect cartilage from oxidative stress and damage, promoting its integrity and function. Adequate levels of vitamin C are crucial for the synthesis of collagen, ensuring that joints remain strong and resilient. Foods rich in vitamin C, such as citrus fruits, strawberries, bell peppers, and broccoli, can significantly support joint health when included in a balanced diet. For optimal benefits, the recommended daily intake of vitamin C for adults is around 75 to 90 milligrams, although higher amounts may be beneficial for those with increased needs. By ensuring sufficient vitamin C intake, individuals can enhance collagen production and support their joint health effectively. Vitamin D3 is essential for bone and joint health, primarily because it facilitates calcium absorption in the intestines, which is crucial for maintaining bone density and strength. Adequate levels of vitamin D3 help prevent bone loss and reduce the risk of fractures, contributing to overall joint stability. Research has shown a significant relationship between vitamin D deficiency and an increased risk of osteoarthritis, as insufficient vitamin D can lead to weakened bones and exacerbate joint pain. To ensure adequate vitamin D3 levels, individuals can obtain it through sunlight exposure, which triggers its production in the skin. Additionally, dietary sources such as fatty fish, fortified dairy products, and egg yolks can help boost vitamin D3 intake. Maintaining sufficient levels of this vital nutrient is key to supporting bone and joint health. Vitamin K2 plays an essential role in bone health by activating proteins that help bind calcium to the bones, ensuring proper mineralization and strength. This process is crucial for maintaining bone density and preventing conditions such as osteoporosis. Additionally, vitamin K2 is important for preventing arterial calcification, as it helps direct calcium away from the arteries and into the bones, promoting cardiovascular health. Food sources rich in vitamin K2 include fermented foods like natto, hard cheeses, and egg yolks. For those who may not get enough from their diet, supplementation can be beneficial. To optimize absorption, it is recommended to take vitamin K2 with a meal containing healthy fats, as this enhances its bioavailability. Ensuring adequate vitamin K2 intake is vital for supporting both bone and cardiovascular health. In this video, we explored 6 key nutrients that can significantly improve cartilage health and reduce knee pain: glucosamine chondroitin, UC2 boswellia, serrata hyaluronic acid, and vitamin C and D3. Each of these nutrients plays a unique role in supporting joint function and alleviating discomfort, making them essential for anyone looking to enhance their joint health. We encourage viewers to consider incorporating these nutrients through dietary changes or supplements to promote better joint function and overall well-being. If you found this information helpful, please like, share, and subscribe to our channel for more informative content on health and wellness. Your engagement helps us continue to provide valuable insights and support for your journey toward improved joint health. Thank you for watching.